Hospitals are turning to more voice technology to help patients schedule visits, to help clinicians take notes, and even to help diagnose some illnesses. But for long-term success, voice tech will still have to prove itself useful and secure. These days, patients can hold a conversation with an app to view their medical records or to talk to experts. Nicole Caputo with UC Health, a hospital system that includes the University of Colorado, says it's tried to make its voice and AI tool, Livy, approachable.
She can help you find doctors, locations, and health information. We most recently just launched her in our UC Health mobile app. So I can go on my phone at any time and ask Livy for my latest test results, or ask her to cancel my appointment tomorrow.
HCA Healthcare, a hospital system in 20 states, uses voice recognition to help clinicians take better notes in patients' electronic medical records.
When they document, they have to put in the discharge note. Hospitalists who have a very lengthy note, psychiatrists who have a very lengthy note. Radiology's been a huge adopter of voice recognition because all of their analysis is qualitative and looking at the image and translating it into a report.
Voice recognition is even starting to help identify illness. The Mayo Clinic tells Newsy it's researching how your voice can help doctors detect disease.
Using the voice characteristics, we call them utterances, the frequency and the intensity of the voice, to help us diagnose potentially coronary artery disease. They did a study looking at angiograms in 138 patients at Mayo and correlated that with their voice, and they listened to their voice during this time period and saw a correlation between the voice as a diagnostic tool that correlated with the higher risk of having coronary artery disease.
Experts say the next challenge will be making voice recognition in hospitals more interactive. Instead of just responding, it might start to learn.
What we want it to be is more of a contextual knowledge interface so that it will understand if there were mistakes made or resolving an issue and correcting it to say, do you mean this?
Any hospital using voice recognition technology also has to consider new privacy concerns. Newsy spoke with providers who say they often give their voice data stricter privacy standards than medical information protected under HIPAA, but they added patients may still want to make sure their hospital has secured its Wi-Fi.
It's ultimately a personal decision, but the burden is on the providers. We make sure the MRIs are safe, the CTs, all those technologies, the shots, the blood pressure cuffs, all those things are safe. Voice recognition falls into that category as well. As the technology companies begin to deploy technology like voice recognition, then the burden's on them.